This presentation is about electronic health records and was created by Team 2, Christy Caldwell, Claudia Carvajal, Melissa Cruz, Mary Crosby, and Christopher Dallasy. Overview of the information systems and information technology. Almost everyone has been to a healthcare provider of some sort and noticed that every time you visit, the doctors and nurses take certain measurements such as weight, height, blood pressure, and temperature. These measurements have always been recorded and filed away for review on any other follow-up or return visit. They also take note as to what may be prescribed, recommendations, or diagnosis that they may have for you. This is a form of information system that the healthcare provider uses to keep track of you as an individual patient. Most likely, these records are kept digitally and are referred to as electronic medical records. These records are helpful because they can track data over time, identify when it is time for preventative screenings, monitor patients over time, and improve the value of care in a practice. The limitation is that it is not easily shared with other healthcare providers, and in most cases has to be printed out and mailed or faxed for other providers to view. Over the past decade or so, it has become obvious that the healthcare industry can be much more efficient, reduce errors, share records, pass information, and diagnose patients if they make all information systems of electronic medical records compatible by what is called an electronic health record. The electronic health record is so important because it collects data from a patient's entire medical history with all types of healthcare providers, including but not limited to primary care specialists, therapists, physical therapy, surgeons, oncology, radiology, and gynecology. The electronic health record was truly designed as a real-time, patient-centric record that gives instantaneous access to history by all providers that are authorized users. It opens up a much more efficient way for doctors to treat their patients and to consult with one another without losing weeks in between communication. As it will be discussed in further detail a little later, the Obama administration felt that the implementation of the electronic health record was so important that it placed mandates on the healthcare industry to get all healthcare providers on board by using tax implications. The implementation of the electronic health records can be processed in 6 easy steps. First, assess if the practice is ready. Second, decide which approach you will use. Third, select or upgrade to a certified electronic health record system. Fourth, train staff and implement. Fifth, achieve the meaningful use of electronic health record. And finally, continue to improve on the overall quality of your care. A brief history and timeline of development. Electronic health records first appeared in the 1960s. Approximately 73 hospitals and clinical information projects and 28 projects for storage and retrieval were underway by 1965. Mayo Clinic in Rochester, Minnesota was one of the first hospitals to implement electronic health records. Electronic health records began in the 1960s because of problem-oriented medical records, which was the first time third-party facilities were able to independently verify the diagnosis, creating a more effective means of communication for healthcare teams. El Camino Hospital in Mountain View, California, implemented Eclipsys in 1971, which was created by the Lockheed Corporation. Eclipsys is now an integral part of Allscripts, which is a company that provides doctors, hospitals, and other providers of healthcare with electronic health record technology and practice management. Also, in 1972, the Registry Institute in Indianapolis implemented the first electronic medical record as seen today. Unfortunately, it was so expensive that the electronic medical record system did not spread among physicians and was only used by government hospitals. The Department of Veterans Affairs implemented an electronic health record called the Decentralized Hospital Computer Program and the Composite Healthcare System in the Department of Defense. In the 1970s, this system later became known as VISTA. In the 1980s, computers were used in more private medical practices. During this time, medical records were more portable than ever, but records were still mostly paper records. Business technology advanced and records could be sent via fax. In 1987, Health Level 7 was founded in order to address standardization issues as electronic health record development pushed forward. Health Level 7 has members in 55 countries today. By the 1990s, technology and computers were used in most healthcare offices. In 1991, the Institute of Medicine set a goal that all physicians would be using computers in their practice by 2000. With the internet age, large-scale changes in electronic health records became more visible because even during the early stages, the internet was a vital tool for recording and transferring medical records and prescription histories. The federal budget for the healthcare IT projects doubled during presidency of George W. Bush, who issued an executive order in 2004 that created the Office of the National Coordinator of Health Information Technology and gave a call for nationwide implementation of electronic health records by 2014. Today, medical records are increasingly paperless, but there are still some private practices that continue to use a combination of paper and computerized records. Regardless, the medical records of today are far more accessible than ever before because data technology has become increasingly portable and comprehensive. Healthcare uses of electronic health records. To achieve a congruent environment of electronic health record data, integration must be standardized across all levels. These standards include 1. A common unique patient identifier, 2. Messaging standard, and 3. Data encoding standard. Some of the implications. Although patients are covered under federal and state laws, such as the Health Information Technology for Economic and Clinical Health Act, which was established by the Obama administration, misuse of data is more likely in a computer-based system where access is easier to obtain. Epic is taking over the market, and as of 2013, it was reported that at least 51% of the U.S. population was using Epic as their electronic health record vendor. One of the benefits of this monoculture, as Capel and Lehman state, is that it allows for easier standardization and uniformity of information. If companies use the same vendor for their EHRs, it is easier to train their employees to learn just one system rather than having to adjust for the nuances of using different systems. Relevant IT components. Along with expanding information technology, what should be firmly established is the components that compose and govern the culture of IT in the healthcare industry. The technical aspects of IT infrastructure consist of shared and tangible IT resources to accommodate businesses with present and future application innovation. This composed infrastructure is referenced when making plans related to IT advances, as plans should align with business objectives, the IT architecture, and the skills of IT personnel. A study conducted by Chung, Rayner, and Lewis critiques the four components of IT infrastructure flexibility. The purpose in studying an infrastructure's flexibility was to see if it significantly impacts strategic IT business alignment and the extent of applications implementation. The results reveal a positive relationship. This composed infrastructure is referenced when making plans related to IT advances, as plans should align with the business objectives, the IT architecture, and the skills of IT personnel. The inclusion of IT personnel skills is what composes the fifth resource of the above IT checklist. As various individuals from different backgrounds and cultures bring something new and unique to the table, which allows for collaboration to enhance services. The services are what provide a foundation for businesses to not only better communicate with their customers, but also communicate with all departments of the whole organization. Compatibility allows for an organization to share information across multiple platforms, which consists of most of the discussions of electronic health records integrated into technological platforms. Modularity allows for easy configuration of all operating components, as businesses will always add, modify, and remove services and processes that do not place them on the critical success path to reaching their goals. Altogether, connectivity allows for all components to communicate with each other inside and outside of the organizational environment. Connectivity is the glue between all components. Without it, modularity cannot be closely monitored and compatibility would be eliminated. Thus, Chung, Rayner, and Lewis's study of the conceptual model of the infrastructure, components, and strategic alignment reveals that there is a solid empirical relationship between all components and parties involved. It is fundamental that a firm's IT strategy is closely linked to its organizational strategy, of which the degree of infrastructure and flexibility determines. IT infrastructure and flexibility graph. Communication is a great key to enhancing services and collaboration within and outside a business, which plays into IT infrastructure flexibility. To visualize how this works, it would help to put compatibility, modularity, connectivity on a coordinate plane. If a firm has high IT infrastructure flexibility, then they have high compatibility, modularity, and connectivity, landing it in the top right section of the coordinate plane. The other three sections not in use can help explain which of the remaining components are high and which are low, which would contribute to the placement of the firm's flexibility in the negative numbers, indicating little or no flexibility in either compatibility, modularity, or connectivity, or all. The same can be said about high flexibility in relation to higher positive numbers in the coordinate plane. The more communication that is present, the more a firm will find itself in the positive numbers of the coordinate plane. The lesser the communication, the little compatibility and connectivity there is. It adds to the numbers, putting the firm in a more positive environment rather than a negative one. Essentially, communication is the catalyst for decisions and actions, as it leads to collaboration and innovation. If companies in the healthcare industry were to rate their infrastructure on coordinate plane, what would that say about them? Some of the benefits of electronic health records. The ability to transfer patients' information more easily from one department to another or from one provider to another is probably the first benefit that comes to mind when thinking of the benefits of electronic health records. This allows clearer and quicker lines among different departments and even different healthcare providers. However, there is a perceived more beneficial reason for electronic health records. This is medical staff's ability to sort through data to retrieve desired information they may need. This is helpful where drug prescriptions are concerned. Medical staff can see what the patient has had in the past, what they are taking currently, or any other pertinent information. Another direct result of health professionals' ability to sort through health records is a decrease in repeated tests, exams, and invasive procedures that a patient may have had to undergo because previous requests and/or results went unnoticed. In fact, a recent study showed that patients who were treated by medical personnel using electronic health records were 15% more likely to live than medical personnel using paper versions of health records. This can mainly be contributed to the decrease in errors when correctly using electronic health records. Risks of electronic health records. Like most technology, electronic health records are only as good as its end users. One hurdle in the implementation of electronic health records is the physician's willingness to use it. The provider's inaccurate use of electronic health records sometimes contributed to the provider's unwillingness to be educated. Originally saw an increase in medical records mainly through incorrect drug prescriptions. However, the initial increase in medical records has changed directions as previously stated, and providers using electronic health records are seeing fewer medical errors. This comes through with advancements in the technology as well as more informed end users. Other concerns regarding electronic health records primarily fall under the patient's confidentiality umbrella. As with most technology, cyber attacks are a concern. The ability for an attacker to expose patient information goes against the healthcare goal, widely thanks to HIPAA of patient confidentiality. There is also the hurdle of who can access patient information. While the benefit of electronic health records is the ease of information transfer, it comes with a risk of the ease of information transfer. Those who do not directly need to access the patient's information may still do so, allowing for breaches in patient confidentiality. Although the counter-argument is that administrative workers in the healthcare office once had access to patient information when they were handed the patient's paper chart when checking out the patient. One final risk that should be mentioned is that of bugs and viruses that could cause glitches in systems supporting electronic health records. This could cause downtime, slow response time, or even more concerning, inaccurate or out-of-date information being seen by providers. When it comes to the risk of electronic health record implementations, it is cost that really comes into play. Around 2005, when electronic health records really began to emerge, Rand Corporation predicted that the conversion to electronic health records would produce savings upwards of $81 billion. However, in 2017, there has been a rise in healthcare expenses upwards of $800 billion. While the rise in healthcare expenses cannot all be attributed to the conversion and use of electronic health records, there were more related expenses associated with electronic health records than originally believed. Costs associated with electronic health records do not just begin and end with its implementation costs. There are also the recurring costs of subscriptions, software updates, storage costs, and costs of IT staff to maintain servers and other technology related to electronic health records. The benefits of advancements brought on by electronic health records does come with a price, and it's not cheap. However, future trends are looking to improve the risks associated with electronic health records. The American Medical Informatics Association has recently created a task force that aims to improve electronic health records. They include the patient's ability to access their healthcare data, making documentation within electronic health records easier while increasing the data integrity of said electronic health records, and seeing the use of electronic health records to become more innovative rather than just reacting to technological advancements. The increased use of cloud technology is also changing the future of electronic health records. The use of the cloud helps in curbing costs and helping ease the burden of the implementation costs. These benefits are especially meaningful to more rural areas that do not have large hospitals or access the technological workforce that large cities do. We conclude our presentation with the many references we referred to for our information. Thank you so much for viewing our presentation.